A warm welcome to all. I'm Dr. Uttara Mohan from the IIP Digital Media team. We are here for the webinar on role of exercise in diabetes. The resource person is Dr. Dhruv. This webinar is being organized by IIP Women's Cell Kheda district, Gujarat. The organizers for today are Dr. Vaibhavi Ami, district sub-coordinator, Dr. Mitwa Thakkar, district sub-coordinator, and Dr. Heta Patel, district coordinator. We are live on IIP India YouTube channel. I request all to subscribe to this channel to get regular notification during our live webinars. Now I hand over to the organizers.
Thank you, ma'am. So first of all, very good morning to all the participants, and also happy World Diabetes Day. As you all aware that 14th November is celebrated as World Diabetes Day. So we have organized this webinar to celebrate that day so that the person who is suffering from diabetes can gain some knowledge from this webinar, and also healthcare professional can gain some knowledge and can help the person who is suffering from diabetes mellitus. So that is the aim for organizing this event. So as ma'am mentioned already that today's our guest for this lecture is Dr. Dhruv sir. So I would like to give some glimpse that sir, first of all, we welcome you, sir. So sir is currently working as an associate professor at Ashok and Rita Patel Institute of Physiotherapy, Charusat, Changa. And sir is departmental head and department in charge of community department at Charusat University. Sir has finished PhD under guidance of Dr. Ali Irani sir at Charusat University on 6th June 2020. Sir has done both bachelor and master from Government Physiotherapy College, Ahmedabad. Sir has worked as an assistant professor in Ashok and Rita Patel Physiotherapy College since from 1st June 2012 to 13 June 2020. Sir has worked as a lecturer in Charusat too. Sir has organized more than 300 community physiotherapy camps in and around 100 villages for Changa to create awareness about physiotherapy treatment in society. Sir is trained for skill enhancement for Milligan concept by Dr. Deepak Kumar in April 2010 at Ahmedabad. Sir has conducted workshop on tapping technique for musculoskeletal disorder and myofascial pain syndrome, diabetes rehabilitation. Previously, sir has been working as a lecturer at Sri Swaminarayan Physiotherapy College, Kadodra, Surat as well. Sir has offered community-based rehabilitation for HIV positive patient and TB patient at Reliance Community Care Center, Surat. Sir has guided 16 research studies for MPT students and 40 research studies for BPT students. Sir has presented a specific scientific paper at National Consultation on Adolescent Health on effect of backpack on trunk muscular endurance in adolescence at Karamsar. Sir has presented scientific poster at National Conference of Physiotherapy in Public Health, CHEPCON 2015 on prevalence of risk factor of coronary artery disease among school teachers in rural area of Kheda district. Sir has presented scientific poster at World Congress 2015 on identification of barrier of adherence to exercise in type 2 diabetes mellitus, a cross-sectional observational study held in Singapore between 1st to 4th May 2015. Sir has presented a scientific paper at 7th International Nepal Physiotherapy Association Conference on comparison of balance rehabilitation among diabetes versus non-diabetes below knee amputees held in Kathmandu, Nepal. Sir has presented a scientific paper at 52nd National IAP Conference on effect of back pain on trunk muscular endurance in primary school going children, a pilot study held in Indore. Sir has also presented a scientific digital poster at 49th National IAP Conference on Dynamic Balance and Mobility on ONE patient held in Pune. Sir has presented a scientific paper at International Conference on 9th WCPT IAP conference, that is Balance Rehabilitation in Lower Limb Amputees, held at Mumbai. Sir has presented one keynote address at 7th Goodset Conference 2013 on role of physiotherapy in prevention and management of type 2 diabetes mellitus, held at Changa. Sir has presented two keynote addresses at second Goodset Conference 2008 on approach to a patient by physiotherapists from government sector point of view, and also synchronization of syllabus of all the university across Gujarat. Sir has taken lectures of students of Princeton University, USA, in collaboration with Charusat University. Sir has been a member of Board of Study of UG and PG at Charusat, and Sir is also invited as an examiner for various university across Gujarat and Maharashtra. So I hope we can gain some knowledge from Sir. So over to you, Sir.
Yeah, thanks, Dr. Vaibhavi, for an elaborative introduction. Even I was not knowing that many things have been done from myself. Fine. So thank you. I have shared my screen, and I hope it is visible. Right?
Yes,
Okay.
sir, it is visible.
Fine. So good morning, friends. This is just one day prior to celebrating World Diabetes Day. That is across the globe being celebrated on 14th of November. And this time, the theme that has been kept for the World Diabetes Day celebration is education to protect tomorrow. So I would like to brief the things in and around that particular theme of education to protect tomorrow. Prior to starting my presentation, which I have learned from many of my teachers and fellow friends, that I would like to acknowledge. First acknowledgement, naturally, to the Kheda district branch office bearers for providing the platform for individual like me to present my views and share my thoughts and ideas. Similarly, the acknowledgement to the state as well as the National IAP Women's Cell for promoting the physiotherapy amongst the physiotherapists as clinicians, academicians, among students and population at large. I would like to thank even IAP President Dr. Sanjeev Jha sir, and special thanks to my PhD guide Dr. Ali Irani sir, who imbibed the seeds of working somewhere down the line since 2011 for type 2 diabetes patients. My principal of the institute at Charusat, as well as staff members who always have a sort of healthy competition amongst us to promote and share ideas across the globe. My students and patients, because of whom I am in a position to stand in front of you. My teachers who have enlightened me since 1998, and my family members whose constant boost up and moral support is there. I want to have a sort of disclaimer down over here, is that during this particular presentation, whatsoever are the views or opinions are the opinions of mine, and people may have a sort of contradictory viewpoint as well. And these are the kind of information that has been provided for general purpose. These all informations are in relation to good faith, and one need to be warranted for any kind of express, implied, and in regards to the particular information that is being shared through this particular presentation. So this is what a kind of disclaimer I would like to share with you. The contents which I'm going to have it today is as what Madam has said about World Diabetes Day. So I'll talk few things in relation to what sort of data, which is what is existing at world level, at Southeast Asia level, and especially at Indian context. And then we'll gradually move to from that data to how we can utilize those data so that my physiotherapist friends are able to learn on as well as educate the group of individuals, those who are working in relation to diabetes. So to start with, I'll just share a small little video with all of you. Yes. Yeah, so that was about a small video, which is from International Diabetic Federation. Now moving on to one of the slok from Sanskrit I would like to narrate here is Vyayamat lapte swasthya dirghayusyam balam sukham arogyam paramam bhagyam swasthyam sarvartha sadhanam. So it means by that one need to do exercise which is what is necessary, not only just for physical health, but for the longevity of life, quality of life, to be disease free. It is necessary to do exercise. Yeah. The question that comes down to each one of our mind, that why the symbol in relation to World Diabetes Day is a blue ring, blue circle. So blue is the color which is what is representing the sky, and similarly the color from United Nations flag. So this particular circle of blue ring represents that collaboratively and collectively all nations should work together for combating the diabetes pandemic. Begin with, if just last year only we had the 10th edition booklet that has been released from International Diabetic Federation. And if you look at the data that 1 in 10 from the age group of 20 to 79 is suffering from diabetes, which counting for 537 million. 1 in 18 had some sort of impaired fasting glucose. 1 in 2 adults remain undiagnosed. So whatsoever the kind of data we have, there are many more who remain undiagnosed for a longer period in time. 6.7 million deaths that has been attributed to diabetes in particular year, and 11.5% of global health expenditure that has been spent on diabetes. So these are some of the fearing facts for diabetes. Moving on to, if I'm talking about through the atlas again is suggesting that across the globe, the diabetes is rising. Whether I'm talking about Western world, whether I'm talking about poorest of poor like African countries, whether I'm talking about low and middle income countries like Southeast Asian countries, we all are increasing so far as concerned with the data on diabetes. And if particularly I'm talking about 68% rise is what is from Southeast Asia. Talking about, as what I've said, 537 million adults gets affected. 3 in 4 adults with diabetes, especially are coming from low and middle income countries, and 6.7 million deaths that has occurred in 2021. Talking about Southeast Asia, 1 in 2 adults remain undiagnosed, and 747,000 deaths that occurred because of diabetes, and 10 billion spent on diabetes so far as concerned with Southeast Asia. So I've talked about world, I've talked about Southeast Asia, now I'm talking about India. So 1 in every 11 adults in India is suffering from diabetes. 1 in 5 from the world coming from Southeast Asia, and 1 in 6 from India. So these all are a sort of shocking truths that one need to face. And if we look at the prevalence of diabetes of 2019 data, this is a sort of, again, a shocking picture altogether, where more than equal to 10% of the population is prevalent. Now, another point of concern for diabetes is diabetes eventually at macro and micro level affecting body. And along with diabetes, it is bringing with him the 2 sister concerns, obesity and hypertension, and which ultimately eventually cause a sort of greater amount of morbidity as well as mortality. So far as concerned with the diagnostic criteria, it may be the fasting sugar or 2-hour sugar or HbA1c, which is one of the primary area of concern where most of my near ones and dear ones, my patients and friends, they would and may cheat in relation to fasting plasma glucose, and in them, that is the reason why the 3 months average, which is what is glycosylated hemoglobin, is to be taken into consideration as the appropriate sort of value. Now, if I'm talking about management of type 2 diabetes, we have either diet as part of our concern, lifestyle modification along with behavioral changes, we have exercise, and then we have medications, right? And along with that, as what the video has shown, that diabetes is bringing disability, poverty, and whatnot, all things together. So one need to treat about all associated things that is happening along with diabetes, like maybe dyslipidemia, to hypertension, to obesity, to coronary artery disease, and so on and so forth. And along with that, the kind of secondary complications it is causing, may it be a case of retinopathy, to nephropathy, to diabetic neuropathy, diabetic foot ulcers, so on and so forth, right? Now, if I'm talking in general about diabetes and talking about exercise, what so far I had done in relation to make people understand about search strategies for PubMed, Embase, and Cochrane, and find out that whatsoever the kind of systematic review and meta-analysis, and compile them down over here to find out that what sort of things that might be done in relation to exercise. And first, if I'm talking about aerobic exercise, what it is the frequency of exercise, which may be lasting from 1 session per week to 7 sessions per week. If I'm talking about intensity of exercise, it may be starting with as low as 50 to as high as 85% of VO2 max, or 55 to 85% of heart rate maximum. And if I'm talking about the duration of the exercise, it may start with 40 minutes to 75 minutes. Now, the major point of concern here is, and that sort of questions naturally comes from the patient perspective, is that how long do I need to do exercise? And I always say to my patients that the way your daily course are, you brush, you bathe, you eat, similarly, one need to do exercise, right? One of the quote I am able to recall here is from Dr. Deepak Kumar, is kasrat kasrat sab kare na kasrat koi, kasrat jo sab kare to दुनिया में दुख न रहे कोई. So exercise is very, very, very important. And this is a sort of dosimetry I am coming through by going through various systematic review and meta-analysis. If we are talking about progressive resisted exercise, which is one of the in thing, is the frequency could be between 2 to 3 days. So every alternate day, you can switch over from aerobic to resisted, and likewise, and the intensity would be 50 to 80% of 1 RM with duration of about 40 to 60 minutes. And the kind of results it's going to show would be from 8 weeks to 26 weeks period of time. Now, if I'm going through the next thing, what sort of type of exercise one should look for if the aerobic or PRE or others which we have come through when we have done a sort of systematic review. And in aerobic, the type of exercise that has been said is cycling, swimming, treadmill, cross trainer, arm ergometer, jogging, so on and so forth. For progressive resisted, they involve major group of muscles of lower limb, of upper limb. One can do exercise with free weights, with therapeuts, with therabands, and few other examples which are since ancient eras, but now the sort of in things are yoga, tai chi, and many others. Now, if I'm going into detail about aerobic exercise, what sort of detailed dosimetry it should have, the dosimetry suggests that one need to have warm up, one need to have a sort of cool down, and which involves the major stretching of quadriceps, hamstrings, biceps, triceps, and the backs. Along with that, 5 minutes of sort of unloaded cycling, so to make the body ready for any sort of aerobic exercise. One can go through this form of exercise with 3 times per week, where one may have a sort of upright bicycle, to that of treadmill, to that of elliptical bicycle, and comprising of the duration which is between 40 to 60 minutes. There, the question which is bound to happen from your side is that can anyone start exercise straight away from day 0 for 40 minutes or so? So the answer is no. One need to warn the one is not doing exercise otherwise, and if we are putting them for any exercise, start with lesser amount, involve more time in warm up and cool down, start with about 20 minutes, and then gradually every week increase few minutes of exercise. So eventually you are in a position to reach to this level, and you are otherwise not going to harm any sort of muscles or other soft tissue structures. Otherwise, what will happen that your patient may end up with other aches and pains and will not turn down back to you. So it is necessary to go gradually, right? For resisted exercise, for other 3 days, which we routinely advise, like Monday, Wednesday, and Friday, one should go for aerobic. And Tuesday, Thursdays, and Saturdays, one need to go for resisted, or vice versa, depend on what sort of things one has. Again, in terms of warm-up, like we had advised for aerobics, similar sort of warm-up is necessary. And here it is what is necessary to do sort of sets of exercise with free weights, with therabands, therapeuts, and likewise. And I am a person who works in community. In that context, it would even be possible to work with whatsoever a kind of water in water bottle and can be used as a sort of free weights. That would be possible. Similarly, a sort of weight one can put inside a sort of bag and tied down to the lower extremity and can do a sort of exercise. That would be possible. Not necessary to have a sort of gym facility and could be done because I am working from a sort of rural area of one of the developed state of India. Still, in terms of consideration about health in the top 10 priority, very few of them that sort of concern. So in relation to that, what sort of exercise one may have is about straight leg raise, hamstring curl, bicep tricep curl, about lateral raise, front raise, and similar sort of exercise, which is what is comprising of about 30 minutes with about warm up and cool down, so that ultimately it is going to be for 40 to 60 minutes. Again, in here, the case is that one cannot start straight away. Slow and steady wins the race is to be taken into consideration. Now, one of the major point of concern, which I always felt since 2012, when we have started our work in community, and most of my patients and the female counterparts whom we addressed as homemakers, they had this sort of concern, is that most of them, they are doing sort of basic daily activities and they consider it as a part of exercise. So here I would like to make all of us clear that that is to be considered as a sort of physical activity and not exercise. Physical activity is what any sort of body movement which is otherwise required only a sort of energy but not challenging any body. One is not going to be out of breath, and likewise. While exercise is what is a sort of planned and structured, repetitive, and with a sort of intention for the improvement, which is to be considered as exercise, and which is as per the WHO recommendation, at least 30 minutes a day, 5 days a week, which will ultimately help in improvising the physical fitness, right? So that is what we need to take into consideration when patients, especially the homemakers, they come down. We need to make them understand that what is physical activity and what is exercise. Now, one of the biggest problem we as a physiotherapist we face is majority of us are doing under prescription, and that is the reason why the kind of benefit one may get in relation to diabetes, in relation to fasting plasma glucose, in relation to HbA1c, one may not be in a position to get. And another point of concern is about combination of inappropriate form of exercise. So one need to be absolutely precise in terms of our prescription of exercise in relation to our FAR. F stands for flexibility, A stands for aerobics, and R stands for resisted exercise. One of the concerns always comes from patient is that if only I am doing walking, would that suffice in relation to managing my sugar level? So there I always insist that if it is just walking, then eventually after 3 weeks to 6 weeks, the kind of change which you want to bring about, you are not able to bring in. And as you are not able to bring in, eventually you will lose interest in doing exercise. And that is the reason why my advice is one need to do exercise under supervision, especially at the initial stage, so that the kind of events nowadays in our surrounding happening, that people are just dying up in the gym and likewise are not going to happen because of the kind of prescription which is what is necessary is not being brought off. So what one should do is, from patient perspective, one need to make up the mind, right? And as you know, in our surroundings, our physiotherapy centers and gyms, they are booming around as the winter comes. And as soon as after 2-3 months, once the summer restarts, again, the people lose their mind and exercise and gym and likewise. So one need to make up the mind if they want to overcome diabetes. One need to be regular, and the kind of regularity I always insist to my patients is that if you breathe, if you brush, if you bath, similarly you need to do exercise, which is necessary. How much one should do and what exercise to do, that let your therapist decide. Depend on what sort of body structure you have, depend on what sort of capacity you have, which is to be assessed, analyzed, and accordingly one should take a call that from where one should start and how one should progress. Another point of concern from most of our patients so far as concerned with diabetes is that they unnecessarily compare. And when unnecessary comparison comes, I always insist to my patients and show them my hand with the fingers that these 5 fingers of mine, though they are of mine, are different. So if the individual is completely different, one cannot compare that someone is walking and getting results, the similar thing will happen, or someone is doing swimming, someone is doing dancing, someone is doing yoga. So similarly it will happen in me. One need to know what will be appropriate to the particular body, and then accordingly it is to be decided, right? Yes. So a few form of exercise like dance, sports, swimming, and likewise. Yes. Now for this particular session, I had gone through one of the important article, and which is one of the in thing, that is anti-gravity exercise. Here I would like to quote and give enough credit to Professor Tripathi from Freedom from Diabetes Foundation and other fellow scientists, those who have worked very hard. They are working in relation to reversing the diabetes, and one of the beautiful things they have said through this particular research paper is that it would be possible to ultimately sort of reversing the diabetes. Now, what in relation to anti-gravity exercise they have talked about is the anti-gravity exercise need to be a sort of combination of aerobic and anaerobic, right? Which should involve the large group of muscle. It will ultimately, once start doing, it will help in improvising the glucose uptake from blood. It will open up the locks, which are what, because of the insulin resistance that has happened inside the body, inside the cells. So it is going to be a sort of khulja sim sim that's going to happen by doing anti-gravity exercise. And first exercise, which is from the anti-gravity exercise, which is very easy to be done, is what is climbing up and down. Now, we all know in our surroundings, at our working place, here and there, and likewise, a kind of steps that's going to be available is very easy. And one of the things this particular research paper wants to talk about is that one can do exercise, especially after taking a meal. 2 hours after a meal, it is necessary to do a sort of 5 minutes of climbing up and down that will regulate your shooting of glucose up there from the blood. This is to be done 3 times a day. So 3 meal, 3 times, one should do 5 minutes to 10 minutes of climbing up and down stairs. Now here, a kind of red flags which I would like to say is about if someone who has ejection fraction, which is what is less than 30-35%, so they should be warned not to do this exercise. If someone as the age advances, the kind of lifestyle disease and disorders happen, someone has the issues with knees, then they should avoid this exercise of climbing up and down. Or in those individuals where BP is suddenly and drastically changing too much, so in them this particular first anti-gravity exercise, which is what is climbing up and down, is relatively contraindicated, right? So that's the first exercise, but then there are a few others as well, which if you are not in a position to do because of the issues with knee, issues with that of your heart or blood pressure, then the second one is for you, which is what is about the dumping of nitric oxide. Now, dumping of nitric oxide, there are the 4 exercises, which are again anti-gravity exercise, and which Professor Tripathi and team would like to suggest here is one can do a sort of squats 20 times. Once you start doing squats 20 times, then it is necessary to do alternate arm raise, which is to be done with a sort of moderate amount of speed, which is necessary. Once you do, you will feel a sort of a flow of blood that's going to rush down to those muscles which you are asking them to work upon. From that, you need to do a sort of slight, the non-jumping jacks, that you need to take your hands from center to that of bicep up, and likewise. So this is what is very much necessary. These all exercises need to be done in standing. And then the 4th one, which is the most important, which is anti-gravity Mata Ki Jai. Anti-gravity Mata Ki Jai one needs to do. A sort of my Punjabi friends, when they dance, it's about balle balle. So it's about shoulder press up there in the air, which is very much necessary to be done. So when someone is going to do this sort of exercise, the squats, the alternate front raise, the side raise, and anti-gravity Mata Ki Jai, this 4 exercise will ultimately do a sort of improvisation in the control of glucose from the blood. Each one should be done with 20 times one may start with, and these all are going to help. The exercise which is to be done is especially after a meal of 2 hours, which is one of the very important aspect. This here, I would like to quote my PhD guide, Ali sir, that he wants to insist that one should work upon, and still the area of research is that when one should do exercise. One should do exercise before sunrise or after sunrise, then in afternoon, evening, and likewise. And here also I would like to quote one of the research paper that has just been published in on 2nd November 2022. But prior to that, what sort of benefits this form of exercise one can get is in case of even the knee problem, the one is not able to squat. So in them, one can lie down and even can move the body up in the air, the hands as well as the legs. So one who is being on the overweight and obese side, if they are not able to bear the weight by squatting, they can lie down and can their moves in the air, legs and hands together, and can do improvisation in relation to exercise, the anti-gravity exercise. Now, I'm talking about benefits. It will improvise the cardiac output, immune functions. As the topic suggests, it's not about only type 2, but even type 1 as well. So for type 1, it's going to improve the cardiopulmonary fitness, insulin resistance, lipid level, and ultimately the endothelial functions is going to improvise upon. That will reduce the inflammatory markers up there inside the body and would ultimately help to overcome the dosage of insulin, which is what is required for type 1. For type 2, it reduces the sugar and HbA1c, improvising the insulin resistance and the triglycerides. So it is affecting at multiple levels. It is improvising your cardiopulmonary fitness. It is reducing your lipid levels, your obesity, insulin resistance, and blood pressure. So initially, when I've talked about triangle, about diabetes, hypertension, obesity, so at all three levels, this is going to work upon and will help the individual. Eventually, it will improvise the strength of the muscle. So from fat of the individual will be converted to lean body mass. It will improvise in promoting the weight loss. So strength training, one should focus on. That will help in terms of synchronization, which is one of the major point of concern as the age advance. Most of the individuals, they are not able to have a sort of fall prevention. They do not have that great reflexes as the age advances. So in them, even the synchronization is going to be a big time challenge. And in them, we in community would like to ask them to do a sort of a smiley ball exercise where they can throw the ball against the wall, catch, and can improvising the synchronization. It will help in muscle fiber activation, type 1, type 2, which I'm going to talk about in next slide, lymphatic movement and reducing the acid buildup, which is one of the major and primary area of concern when we are talking about diabetics. Which muscle fibers? So type 1 is ultimately storing and burning the fat. And as the age advances, it is a sort of storage of type 2 converted to type 1. And that is the reason why most of our patients, they say that as the age advances, the circumference around the waist increases. Many of my female counterparts, they say, and previously I used to take it into laughter that naturally as the age advances, the mental satisfaction comes into picture, and the kamar will be converted to kamra and all those sort of things. But important aspect from the exercise physiology perspective, it is about the fat mass, which is going to increase, and muscle mass, which is about to decrease. So type 2 ultimately converted to type 1, and that is the reason why more fat storage that's happening to most of the individual as the age advances. And that fat storage ultimately causes the insulin resistance. And that is the reason why the glucose remain inside the blood and people are not able to use the blood to its optimum level. Yes, I was talking about this, that what time of the day one should do exercise. And here is the latest result from Diabetologia, the Journal of European Association, where they are talking about that especially after noon. So someone who has done moderate to vigorous form of exercise in afternoon or evening, they have improvised upon the insulin resistance. So it is suggested from this particular article that either you do exercise prior to sunrise or afternoon and evening, which is what is a sort of major point of concern one should take care about, and accordingly one should perform the exercise. Now, opposite to counterpart is that if someone who is performing exercise in morning, would not that be helpful? That would be helpful. Not at all. If someone who is not doing exercise to that of doing exercise even at the day period of time, would be having sort of some results. But if we are like in this particular research being compared of, the results are much more in afternoon and the evening. Still, many more researches are needed to be in support of. This is what is done in the Western world, and accordingly, we also need to think about. Another point of concern, and in my introduction, Madam has suggested, and in 2015, when I had in my one and only experience to go in WCPT Singapore and represented my university, and likewise, one of the major and most of the concern is excusitis. Now, what is excusitis is all our patients, they are coming with the inflammation of excuses why they are not doing exercise. So we had done a sort of study in 2014 and presented in 2015 that they say they have lack of time, interest, social support is very much lacking. Many of my female counterparts, they have family commitment. Few of them have aches and pains, bad weather and whatnot. So these all are a sort of excuses one need to come forward with when they do not want to do exercise. Now, naturally, we had talked great about exercise. Few points I'll highlight for diet and few recommendation, and then I am open for the sort of question answers. I'm considering 5 more minutes I am able to talk with. So first, one of the concern is that when we go to grocery mall, shopping mall, sort of things, and when things which are what written that they are light in fat, low in fat, and fat free, and likewise warn yourself, these are the sort of food which, rather than selling their products and thoughts, more of rather than exactly targeting what they should target. Second important aspect, eat food, I mean by the natural food, which you are able to see, which are able to, rather than a sort of packed food and likewise. Third, don't eat anything which you don't like, which is one of the major point of concern when I had gone through few of the TED Talks, and one of the TED Talk speakers she has talked about is that you only should eat which you like. And fourth important point, eat when you are hungry. Most of us, as well as our patient and client population, they eat because they are being said to eat every now and then, even if they don't feel to eat. And the fifth point is no grains, potatoes, and sugar, no GPS. Few points I would like to highlight over here, which were being recommended by one of the prominent dietitian, which would like to contradict down over here that diabetes can drink milk tea or coffee 2 to 3 cups, even with sugar and likewise. So one should take very great things into consideration prior to following this. Diabetics can take idli, dosa, poha, paratha, upma, anything in breakfast. One need to take into consideration about glycemic index as well as glycemic load of various grains, food, macronutrients, and accordingly one should decide. Diabetics should eat all seasonal foods. Again, one should take into consideration about glycemic index and load. There are fruits which are what of low glycemic index. One should prefer to that of moderate with a moderate amount, and the one with are what of a high glycemic index like watermelon and few other fruits. One should possibly to get it avoid. The natural helpful recommendations that diabetes is reversible. Yes, it is reversible. And the important aspect is one need to get fitter and control sugar only by not reducing weight, but improving the lean body mass. So I was talking that it's not about just type 1, type 2 conversion, but it is about doing many more things. Someone who is doing resisted will ultimately improvising the lean body mass and can help. Kidney, liver, heart, nerve, they all are being affected because of the lack of nutrients. And that is the reason why the natural food with the greater amount of nutrition is necessary. No packaged processed food. It is very much necessary to do that sort of stuff. Fruit juice, which is what rather it is preferable to eat the fruit, right? Many of my patients, they comes down that doctors have multi-grain atta shuru kar diya hai. So the point of concern is that take one grain at a time rather than mixing all things together. This is important. Walking is to be considered as a part of only the activity, physical activity, not just the exercise. For doing and considering walking as an exercise, it is recommended that one should do brisk walking and not walking. Many of my friends, they walk at their own pace and ease, and that is not going to help them at all. So weight training is necessary, and yoga se hoga. So few of the yoga which one should do. The opposite counterparts for yoga se hoga is that because in many a times it doesn't help is because this is from the ancient era, and where the people have come across through yoga where they are doing greater amount of physical activity and exertion compared to the 21st century, and there it was very much helpful. Eating dinner, very much necessary. Between 7 to 8, before 8, you finish it off your dinner. Don't eat in front of television and sleep before 10, at least 11. So early to bed, early to rise, make you healthy, wealthy, and wise. Right? So this is your pancreas, which you may be showing that I'm at my ease and I'm just lazy. And if you are going to work, make me work, it would be possible that you can glorify the things so far as concerned with diabetes. That's it. I would like to say I would be very happy to have a volley of questions from the audience. Thank you again, all of you, for a sort of platform providing it to me. Thank you.
Thank you so much, sir. It was at most a great presentation. And now the forum is open for question and answer session. So here we have a sort of questions from the attendees.
Yes,
The
ma'am.
very first question was, what is the psychological difference between fasting and PP and random blood sugar level?
Okay. Yes. So what is the psychology, right, ma'am?
Yes, sir. Psychological and physiological, both.
Yeah. Okay. Now, so far, what my understanding is that most of my patients, when we are asking them to do a sort of testing and likewise, and correct me if I'm wrong, is that they control for 2 days, 3 days, and then they testify themselves. And when they testify, naturally, because of the kind of control they have for past 2-3 days, will ultimately reflect in the blood report. So someone who has taken good control for past 2-3 days naturally will come down with a lower amount of blood sugar, blood glucose, if the fasting is being done, or if the postprandial is being done with a kind of otherwise a greater amount of lunch, which we have as an Indian, will not be coming into its real picture. And that is the reason why the IDF as well as the Indian Diabetic Association would like always to recommend to catch them with the 3 months average of glycosylated hemoglobin, HbA1c. Now, if my near ones and dear ones, they had a greater amount of control for throughout, then their results would be 6.5, 7 and around. But if they do not have that great control, then they will be caught. But if they have only the control for only 1 or 2 or 3 days, they can make me full by producing greater results with FBS and PPBS. Another point, as what she was asking about, is about the psychological point of context. So most of us as a human being would like to be fool others, but they do not know that by doing that sort of cheating and producing the kind of numbers, they be fooling themselves, because diabetes is no one's relative. It is like termite and will affecting your body at micro and macro level. You may not be in a position to understand, and you are only be fooling to your body, mind, and soul. And that is the reason why I always insist that do 3 months average and accordingly have the sort of thing. Yes, ma'am.
Okay. I guess the contestant had enough explanation about it. And the another question from the audience is, I'm the patient of I'm recently diagnosed as diabetes mellitus, and should I directly contact to directly contact to the physiotherapist in my region for having the exercises?
Yes. Now, here is what I have mentioned it about that if you are being recently diagnosed and the kind of risk factors in our context is to be considered are in a way to be on modified side, then try to do 2 aspects together. Number 1 is about your dietary habits, lifestyle changes, behavioral patterns, and second is about exercise. If you do this together, I'm very sure that it would be possible to go back to previously. When I have studied, most of the time I used to have a word of managing diabetes, but eventually after working in diabetes and diabetic patients, and especially for preparing for this particular session, I have gone through many more researches. And now there are many more researchers who want to claim to reverse the diabetes. Now, this is one of the very big thing in terms of reversing diabetes. And many of the researchers, they have said it on the open forum that it is a sort of game, which is what is going on, where it is a point of context and concern about overcoming the pharma sector and doing the things with exercise, with behavior change, with lifestyle modification, and likewise. Now, why it doesn't happen and why it doesn't reverse is because most of our patients and clients, they are tired of doing exercise. They are tired of doing exercise because of 2-3 reasons. Number one reason, which I feel, is because it is freely available, could be done, could not be done, and excusitis is always there. Number two is a kind of prescription which is needed. The kind of overload principle, which is what is needed, is not being done from my fellow counterparts from physiotherapy side. And that is the reason why they feel neglected, rejected, and dejected. And that is the reason why they eventually move to other healthcare professionals. And it is always easy to take a pill and chill rather than moving and mobilizing and coming out of the comfort zone.
Okay, thank you, sir. One more question from our panelist, that are supervised exercise mandatory for diabetes, and can pre-diabetic patients prevent the diabetes mellitus with exercise?
Okay, fine. In terms of exercise to initiate, if it is to be done under supervision, it is always preferable to do under supervision. In case if you are remotely located, and the great thing about COVID is that now tele-rehabilitation again into a sort of booming, and one can be at one place and can address the audience across the globe. So one can even take help of tele-rehabilitation as well. I prefer to do it supervised initially for a few weeks, so that accordingly whatsoever changes, which is what is required, could be handled by my exercise experts, physiotherapists, and then eventually could be had a follow-up weekly, fortnightly, monthly, and likewise. If one is not doing under supervision, then as what I have mentioned in my presentation, we may have a sort of issues, aches and pains, or many of the things which otherwise may happen at cardiovascular level, at musculoskeletal level, which go unnoticed, and our patients or clients will leave doing exercise. So, which we do not want, and that is the reason why I recommend to have supervised exercise for initial, and then once they are mastered, then they can come only for follow-up. Your second question in terms of pre-diabetic patients, naturally, pre-diabetics could be prevented to go for diabetes. And again, if we are talking about IDF data, 1 in 2 remain undiagnosed for a longer period of time. And if we are not going to work in core team with other healthcare professionals, then this pandemic will ultimately cover the whole world and the entire population in the decades to come. So it is very much necessary to work in collaborations with others, educate caregivers, educate patients, educate one and all, which is necessary. Try to motivate them. One of the point of concern is that peer group is necessary. People work in peer group. We love and like to work with friends. As someone who joined the cyclist group they can enjoy, and if someone is not coming, have a call and can push forward, and likewise. So it is necessary to work in peers, and if someone who is in pre-diabetic group work with anti-gravity exercise with a sort of diet, lifestyle modification, behavioral change, again to sit in front of a camera and speak about lifestyle modification and behavioral change, very easy. But to do from client perspective, patient perspective is a greater amount of challenge. But if someone who is serious enough can do greater amount of things. One of the research recently been done that lifestyle modification, and one individual in United States of America per person able to save $2,000 every year. And if you look that aspect for the nations or the globe at large, one is able to save lot of money, and this money could be utilized for other purposes. So if someone who is doing at pre-diabetes level, it is always good. But most of the time, what my patients and clients, I am facing a problem that they are reluctant to go for checking their sugar level. They're reluctant to go for their glucose level testing. And I always ask, and they say that if it comes, then that is frightening for me. But I always insist that if it is coming, one can start taking steps and cannot worsen the picture. So that is a sort of concern.
Much informative, and I guess it will be the last question.
Yes, ma'am.
It is from one of our sincere attendee. That is, one was having prosthetic lower limb with insulin dependent diabetes along with the class 2 obesity. Which kind of exercise you recommend or you suggest make the patient from non-active to active phase?
Yes. So this is if we are talking about the lower extremity amputation, I always suggest, and that is the reason why anti-gravity exercise I have said. And in the anti-gravity exercise, I have said about the upper extremity exercise as well. It's about doing the front raise, doing the side raise, and anti-gravity Mata Ki Jai. If one start doing exercise with upper extremity, with the trunk, that ultimately will even help to move and mobilize the individual, which is very much necessary. And then once we rehabilitate the individual with the prosthesis, even walking, cycling, and many other things would be possible for that individual. Like we have seen many more individuals in Paralympics. With the blades, they are running. With the blades, they are doing cycling, and likewise. So it is very much necessary. One need to motivate that it is always possible, even to overcome, even with the secondary complications, not to happen to the higher version. One should do exercise.
Okay. Thank you so much, sir. It is indeed informative session, and we are looking forward for the similar sessions from you in future as well. I would like to request Dr. Mitwa to wind up the session.
Thank you. First of all, a very big thank you to Dhruv sir for delivering a wonderful session that was kind of a practical session. They, like students as well as physiotherapists and even the patients, if they are going to see this lecture, they will know which exercises to do, when to exercise, how much to exercise, and all of these things. So this was kind of something that can be directly implemented to the routine practice rather than a theoretical lecture that this is how it goes. So I guess that is why this lecture was very special. So I'm thankful to Dhruv sir for taking certain amount of time on the special World Diabetes Day and making this a wonderful session. Secondly, I would like to thank Dr. Sanjeev Jha sir, who is IAP president, as well as Dr. Ruchi madam and Dr. Pooja Kamble madam, who are national and zonal head for IAP Women's Health, for providing us this platform.
and letting this session happen. I'm also thankful to Dr. Bhavna Gadvi madam and Dr. Shweta Parikh madam, who are Gujarat State Head and Gujarat State Sub Coordinator, who has provided and motivated us to do certain sessions. Um I'm also thankful to Heta madam for always, who is KEDA district coordinator, for always motivating us and inspiring us to do such activities on regular basis. I'm also thankful to IFP YouTube channel, and the one who is maintaining this entire session, like Dr. Uttara Mohan madam and her technical team, for providing us this platform, and which is going to be available for many other people, even if they haven't attended it right now. These lectures are going to be available on YouTube channel, so it can be utilized by other people later on as well. So thank you everyone. At last, I would like to thank the attendees who are present over here and who has attended the session, and I hope it was useful for you and you must have learned the role of exercise in diabetes, and you will be utilizing whatever information that has been given to you in your routine practice. Right? Thank you everyone for joining the session, and hope your knowledge about diabetes has upgraded to next level. Thank you. Thank you everyone.
Thank you, Dhruv sir.
Thank you. Thank you, ma'am. Thank you.
Yes. I'm ending, we are leaving the webinar, right? That is the end. Thank you.